Wendy Briggs with another look behind the scenes at what may be going on in your office that you don't know about. This is something that, again, can be really, really damaging long-term to your patients' relationships. If you have new patients that you're bringing through the door, but they're not moving forward with treatment, why do you think that is? Well, too often we don't know, but now we have a way to figure out exactly what's going on. And again, this is what we talk about when we talk about the comprehensive picture of the new patient experience, the 65 different points of contact that occur when a new patient comes and gives you a working interview in your practice. Well, one of the most critical aspects is the financial consultation, and too often we don't focus on this enough. I'm going to give you an example of what we should not be saying, what we should not be doing during this financial consultation, what some team members may be saying that may be driving patients away from making those decisions to move forward with this treatment. One of the worst things you can do, one of the biggest mistakes, is to give them too much information. And I'm going to give you an example is have you join me for a few minutes on this video so that you can see for yourself what I'm talking about here.
Do they take out the old, is it the one with the filling? Is that
Yes, it's the one with the filling. So they have to take out the old filling because that's where the cavity is underneath, and then your nerve is right here, basically. So I wish I could see if I have it too here. So I'm like let's just say this is like your molar here.
Okay.
Okay. So you have a filling here, and this is where the nerve is. She has to take out the filling and the cavity, and then she has to then that's when she stops. And then what she does is she removes the nerve that has the infection. She fills it with basically it's like points, so that way you don't get reinfection. Then what she does is that hole that the cavity that she had to take out, she has to fill that back in.
Right.
So that's why they put the crown in it, because then you have more filling than you do tooth structure.
Now, what is the actual stuff that they stick inside your tooth if it's going down into the root or the nerve? It's not like the silver stuff.
No. It's a material. I mean, it would be like me talking Chinese to you, but they call it gutta percha. And so basically, it's just like a material. It almost looks like a little red piece of plastic that goes inside. It just replaces where the nerve is. So
you don't feel it?
Okay, obviously the challenge here is we've focused on the wrong thing. We're giving the patient way too much information. We think that in order for her to accept the root canal procedure, she needs to know how this procedure is performed. Again, key mistake. We've got to keep things simple. And by getting into too much information, then it prompted the patient to ask more complicated questions. And the patient, really what's happening is we're confusing and overwhelming the patient, which only leads to frustration. So again, really focus on what your team members are saying in this financial consultation. We want them focusing on building value for the services. They don't need to know how the procedure should be done. They just need to know why they should consider having the procedure done. What are the benefits to them? What are the specific reasons that they should consider having this treatment done, and why getting it done in your office is a good idea? So again, focusing on all of the key points, 65 points of contact, we can't forget about the financial consultation or the treatment consultation at the end of the day. It doesn't all rest on the hygiene team. We've got to make sure every team member knows what to say and how to say it. Again, it's not what you say, it's how you say it that matters. And again, this example, a good example of what not to say if you really want your patients saying yes to more treatment.